You did it. We're getting towards the end, so great job. Keep it up. Finish strong. This week we're going to look at the urinary and the reproductive systems. Structures in the urinary system include kidneys, ureters, urethra, and the urinary bladder, and its job is removal of metabolic waste and urine production, regulation of blood volume and blood pressure, regulation of electrolytes like sodium, calcium, potassium, chloride, acid-base regulation, which is really important, and that's going to be looking at the concentration of hydrogen ions and a chemical called bicarbonate. And then also your kidneys are responsible for your red blood cell production through the production of erythropoietin. In terms of reproductive systems, we have an ovary-based and a testes-based reproductive system. So ovary-based is going to include structures like your ovaries, fallopian tubes, uterus, vagina, breasts, labias, clitoris, and endocrine glands. And in a testes-based, it will include the testes, epididymis, vas deferens, urethra, seminal vesicle, prostate glands, Cowper's glands, penis, and then other endocrine glands as well. Main function of the reproductive system is gamete production, so an egg or a sperm or oocyte or spermatocyte, production of hormones, testosterone, estrogen, progesterone, the transport of those gametes, fertilization, implantation, growth, and development of a fetus in an ovary-based, and then also lactation as a secondary function. Some things to think about as you go through this unit this week. Looking at Alex has been diagnosed with high blood pressure, has swelling in his ankles. His doctor's ordering an electrolyte panel and a urinalysis check for his kidney function. His daughter Sarah has been feeling well with fever and vomiting, and his dad Joe has also been having some long-term health effects that are getting worse. So things to think about are what structures are involved in the urinary system, how are the kidneys involved in blood pressure, urine production, and maintaining fluid and acid-base levels, and how is the urinary system involved in both Sarah and Joe's health issues. In terms of reproduction, I want you to think about Alex and Maria are trying to have a baby, and it hasn't happened as quickly as it did when they had Sarah, so they're having some testing done. So things to think about are what are male and female structures involved in reproduction, what are the roles of hormones in reproduction, and what are some factors that can lead to infertility in both the male and the female. Let me know if you have any questions. Keep up, finish strong. Keep up the good work. I appreciate what you've done so far, and you're almost at the end.